Welcome to the Injury Lawyer Podcast, a podcast that discusses all types of injuries caused by all types of negligence. Join attorney Steve Heisler, the injury lawyer, and other experts as they provide valuable insight into your legal rights and help keep you informed. Now your host, Steve Heisler.
Welcome back to the Injury Lawyer Podcast. I'm Steve Heisler, the injury lawyer, and I am the host and senior attorney at the law offices of Stephen H. Heisler and the host of this podcast. I'm so glad you're listening to this episode. You're either listening to it or you're watching it on YouTube. I hope you're well, and I hope that you are getting through this very, very oppressively hot summer. So I hope all is good. The purpose of this podcast is to discuss all types of injuries caused by all types of negligence. And today's episode is titled Sepsis and Septic Shock, Do I Have a Medical Malpractice Case? So the definition of medical malpractice or medical negligence is when an individual who is under the care of a medical care professional is injured by that medical professional because the medical professional deviated from the ordinary standard of care, which is required for all medical professionals in his or her own practice area. So obviously the standard of care for a cardiologist would be different than the standard of care for a urologist or an orthopedic doctor, because there are different standards and protocols that apply to each different practice area. Now, I mentioned standard of care. The standard of care, according to Wikipedia, is the only degree of prudence and caution required of an individual who is under a duty of care. The requirements of the standard of care are closely dependent on the circumstances. So there are 4 elements that you must meet in order to have a medical malpractice case. 1 is a professional duty owed to the patient, a breach of that duty, an injury caused by the breach, and resulting damages. So let's go over that again. So a professional duty owed to the patient means that if you go to an orthopedic doctor, you are paying that orthopedic doctor to examine you, determine what the issue is, and then competently take care of that problem. And if that doctor doesn't do that, then he has breached his duty. So that would be number 2. So number 1 is that there's a professional duty owed to you, the patient, by that medical professional. And then if that medical professional does not perform that duty per the standard of care, which is what we just talked about, then that duty has been breached. And the third element of proving a case of medical malpractice is that you had to prove that you had an injury. So if that orthopedic doctor is doing surgery on you, and during the surgery he somehow, breaks say he's operating on your arm and he breaks your arm or causes more damage, and it's determined that there's medical malpractice, and that caused you now to have a long-term permanent problem, residual problem with that arm, then you've met that element because you had an injury. Your situation is worse off than it was originally when you went to the doctor in the first place, before you had the surgery. And the 4th element is that you have to show damages. Now, I discussed in an earlier case about that you have to have damages to have a case of negligence, and the same applies to medical malpractice. Damages mean, yes, you have a breach of the duty. So there was a duty was breached. and there has to be an injury, which results in damages. And usually, if there's an injury, usually results in damages. So, if the duty was breached and the doctor deviated from the standard of care, but you weren't injured, or you weren't injured any worse off than it was before you went to that doctor, then you don't have damages that you can bring to the jury and ask the jury to compensate you for. So I hope you understand that. And by the way, before we go any further, just want to say hi to our very, very good friend, Russ, our producer. Hey, Russ.
How are you, Steve?
I am hanging in there, my friend. I'm hanging in there. My daughter's getting married September the 9th.
Congratulations.
So, thank you.
Do you approve of the...
Absolutely.
Okay.
I love him. He's the greatest guy in the world, and his parents are great. So I'm really, really looking forward to it. And I'm just hoping to survive until then because, the stress, my daughter has all different types of issues every day about the wedding. So,
So last time, first of all, congratulations on the wedding. It's a
Appreciate
huge
it.
milestone. The last time I was supposed to actually see you and meet up with you, I did not see you and meet up with you. I was in your area going to see an Orioles game, and pardon the thunder in the background. We got a little thunderstorm going through.
You're in Florida. That's standard in the summer.
So I figured you weren't able to show up and enjoy the game with myself and my family because you were redecorating your studio, which I'm looking now, and it doesn't look like it still looks like what you describe as an interrogation room.
Yes, it looks like that. Yeah, that there's somebody to the left of me off camera that has a baseball bat in his hand, and if I don't give him the information that he's requesting, he'll bash my head in. So
there's some motivation, but I will say it was the first time I was able to visit Camden Yards, and it was an amazing experience.
It's a great time. I actually went to the first game at Camden Yards, 1992. The Orioles played the Mets.
I thought you were going to say the first game ever at Camden Yards.
It was the first game ever at Camden Yards. It was 92 was when the stadium was built.
Okay.
And then my friend Bob Johnston, a good law school friend of mine, we went the day before the Orioles had an exhibition game against the Mets. So it was the day before opening day.
Wow.
And we were just like in utter awe of this shrine. So it was amazing. It was amazing.
How many signed baseballs do you have from Cal Ripken?
I got about 2 or 3.
Okay.
We could get into all the Orioles memorabilia that I have. I was just showing for July 4th a lot of my in-laws my daughter's in-laws, showing them my Oriole room. So yeah, it was pretty interesting, and they saw all the autograph balls and stuff. And but getting back to, we are in the process of getting a backdrop, so it will not look like that I am being arraigned by the Baltimore City Police, and I'm
there you go.
Being interrogated for whatever. So
well, we're all looking. All of your fans are looking forward to it.
Thanks, Russ. Well, it's good seeing you, and of course, chime in at any time because
Definitely.
You are.
What is the topic for today?
Well, today the topic is sepsis and septic shock.
Ooh.
And when is there medical malpractice when a person has sepsis or septic shock. So let me tell you a little bit about sepsis. I know that a lot of people have a misunderstanding of what sepsis is. Sepsis is not an infection. Sepsis is the result of an infection. And as I was explaining to you before we started the show, sepsis is the body's inflammatory response to the presence of an infection in an individual. So it can happen in any individual. It can happen in any part of the body. Most cases of sepsis are bacterial infections. So some examples of bacterial infections are S. aureus, S. pyogenes, like S. aureus is Staphylococcus aureus, and then S. pyogenes is Streptococcus pyogenes. Obviously, you can tell that I'm not an infectious disease doctor and I have trouble pronouncing them. Other examples, which are much more easier for me to say, are E. coli. I'm sure we're all familiar with the E. coli poisoning, and pneumonia. And pneumonia is also a bacterial infection, and these are examples of infections that can lead to sepsis. And sepsis can be caused by viral infection. So a viral infection would be COVID-19. There are a lot of people that went septic during COVID-19 that went to septic shock and died. Influenza can also, as an infection, it's a viral infection. It also can lead to sepsis. Fungal infections. And by the way, I always have my cheat sheet here that I'm looking at just to make sure that I stay on topic. But we have a wall air conditioner in here, so I had to kind of keep it, kept close to the computer, or it'll fly away. So you're seeing me kind of pull it away, but that's what that is.
That must be why your hair is blowing in the wind.
Yeah, well, I want to look as
Summertime.
glamorous as I can for my listeners and my watchers. Yeah,
Well,
my viewers. So.
It's a recording during summertime, so we've got to make do.
Yeah, we're going to get through this though. Other causes of sepsis include infections of the lungs, we just talked about, such as pneumonia, kidney, bladder, urinary system infections, such as urinary tract infections. By the way, urinary tract infections are probably the most common infection that leads to sepsis for the elderly and for seniors, so people in their 60s and above. Other causes of sepsis, infections of the digestive system, infections of the bloodstream, which is otherwise known as bacteremia, catheter sites, like urinary catheters, central PICC lines, are all causes of sepsis. One of the main reasons on the PICC lines and the catheters is that a lot of times they're not cleaned up, they're not cleaned off sufficiently, and bacteria gets into the catheter or in the line, and then it gets into the patient, and the body just can't handle it, and the body then, as I said, has an inflammatory response, which leads to sepsis. And a lot of people will ask, well, why can't the body fight it? Well, not everybody's body is strong enough to fight these type of infections. So obviously, seniors, elderly are more immune compromised. Young children, people who are immune compromised, people who have just had surgery and are still recovering from surgery. So other causes of sepsis include wounds or burns. The biggest type of wound that leads to sepsis are bed sores, because when there's bed sores, that's an open wound, and bacteria gets in and causes sepsis. Surgical site infections, the bacteria enters the body during the surgery, or from a wound not properly cleaned. So that's another big cause, is that wounds are not properly cleaned by medical personnel. Ventilator pneumonia, bacteria travels into the lungs. So these are all just different types of infections that lead to sepsis. Now, What are the symptoms of sepsis? So a change in mental status, fast, shallow breathing, lightheadedness, sweating for no reason, high fever or chills, extreme fatigue, low blood pressure, sweating. I think I said sweating for no reason, painful urination from a urinary tract infection, or worsening cough with pneumonia. So these are some of the signs. Sepsis is not always easy to distinguish. I had an expert on my other podcast, the Injured Senior podcast. It's Dr. John Cascone, who is one of the best infectious disease doctors in the country. And he said that one thing that you should look for is if somebody is just acting differently than they're normally acting. Like a change in mental status, if it just comes out of nowhere, and then that combined with tachycardia, which is the heart rate is increased, and maybe a fever or a chill, and then the blood pressure is low. That's a good indication that there could be sepsis. So most people recover from sepsis. It's if it's just sepsis and you're given antibiotics pretty soon and within a reasonable time, then your chances of making a full recovery from sepsis are pretty good. However, if the sepsis is not dealt with in a reasonable period of time, then you have a chance of contracting septic shock. And septic shock is a different story. You do not want to get septic shock. Septic shock is fatal 40% of the time, or your chances of dying increase by 40% if you go into septic shock. So it's serious. And septic shock is simply when you become hypotensive. And hypotensive is when you have a sharp drop in your blood pressure. And when you have a sharp drop in your blood pressure, you're looking at multi-organ failure. And you're having multi-organ failure because there's no blood or oxygen able to be perfused into your multiple organs because the blood pressure is not high enough to perfuse them into the vital organs of your body. And that's why you see people in septic shock before they, when they're in septic shock, usually one of their organs shuts down and they've got to take out the organ. Sometimes they have to amputate the arms, or an arm or a leg or both legs, because there was not enough oxygen or blood to get into the extremities. So I would tell you, if you have septic shock, if you're not in the hospital at the time you have septic shock, you only have hours to live.
So I have a question. I have a question for you.
Sure.
And you're probably going to answer this because we're going to get into the legal aspects of it with, I guess, malpractice and everything.
Right. That's next.
Because a lot of the symptoms that you described for sepsis, a lot of the early symptoms are, some of them are symptoms of anxiety and stress. So, I could see a doctor saying something like, you just need to calm down. You're stressed out. You heavy breathing and the sweating and everything. How do they get to the point to determine? And I know you're not a doctor, so this could be a stupid question, to determine if it's anxiety, stress, or something as what could be critical as sepsis.
Well, when you go to the hospital, to the emergency room, they're supposed to do a full physical examination. They should be doing a blood panel, that they should be doing blood work. So if you go into the hospital and, you've got symptoms of anxiety or some type of emotional issue, but they're also checking your temperature, your blood pressure, your heart rate, and they should be able to recognize whether or not this is something that more than just anxiety. So they've got to do what's called a differential diagnosis. So they can put anxiety as one of the possibilities, but also there's a possibility that there's sepsis. Now, normally they should, if there's sepsis, that means there's an infection. So if they can detect an infection as well, and then they see that there's signs of sepsis, then they need to then take appropriate measures or take appropriate action. But that's their job. Their job is to rule out all the different types of possibilities. And they're not perfect. But a lot of times they don't even do the bare minimum to determine whether or not this is something more than just a cold or an anxiety attack. So that's a really good question, Russ. And septic shock is a killer. If you get into the hospital in sepsis and they diagnose the sepsis, they're going to put you on some strong antibiotics, a broad spectrum of antibiotics to try to calm down the sepsis or try to get rid of the sepsis. If that doesn't work, then there's other measures that are more serious. But again, the idea is to keep somebody out of septic shock. And just so you listeners and viewers, just so you know, 1.7 million people a year in the United States develop sepsis. And approximately 270,000 people die a year from sepsis in the United States. And this is got the information from Sepsis Alliance, which is the leading sepsis awareness organization. If anybody wants to learn more about sepsis, I would go to, I think it's sepsisalliance.org. But I think that's something, a good place to learn. There's also something called neonatal sepsis, and it's something that I think that I want to do a show on later down the road, where newborns are also susceptible to neonatal sepsis. Okay, so what are examples of medical malpractice leading to sepsis? So number one, failure to recognize or diagnose an infection. So again, remember, if you've got sepsis, you've got an infection. So if they diagnose an infection, and then they also see that you've got from the blood work and from their physical exam and from all the other tests that they do that you have signs of sepsis, then they need to take appropriate action. And I can tell you that I have seen multiple times where individuals have come into the emergency room and were sent home in a septic state later to have very, very ominous results because of the negligence, because the sepsis wasn't diagnosed there. So number one and number two, failure to recognize or diagnose an infection or failure to recognize or diagnose sepsis. Again, there are tests. There are blood tests. So for instance, your white blood count always skyrockets when you've got sepsis. It goes up. It's up in the, it's above what it normally is. And all you got to do is you got to take a white blood count. White blood counts are done routinely in blood panels. If the white blood count is off the charts, you've got, there's a very good chance it's indicative of sepsis. Also, something that most people don't know, lactic acid. Your lactic acid also goes up as a result of the inflammatory response. So when you weight lift, and I know, Russ, you're a muscle man. I know you're a gym rat. When you work out,
didn't mean to interrupt. but I guess I did it anyway. As soon as you mentioned lactic acid, so as a coach for youth baseball, anytime I have a pitcher that pitches a few innings, all of the pitchers that pitch that game have to run a lap or two because of the buildup of lactic acid. So yes, with weightlifting as well.
Weightlifters, they after they do their workout, their lactic acid is really high, but then it comes down. Here, it's not coming down, and you're not. It's not like Arnold Schwarzenegger is coming in there, and his lactic acid is high. These are people who are sick, and their lactic acid ordinarily would not be this high, but for something really unusual going on, and that is usually sepsis. So, and of course, they're going to check your heart rate. If your heart rate is up, there's a new test that I read about called IntelliSep, which identifies changes to white blood counts. So, the white blood count, again, there is no test that definitively diagnoses sepsis. Like, they don't come back and say, you have sepsis because the blood test says you have sepsis. No, the blood test gives you, and the testing gives you indicators, okay? So, right. So when you go into the hospital and you're not feeling right and you've got these symptoms, they have got to do the testing. They've got to do the physical exam. They got to do the blood test, the urine test, if there's wound secretion. So again, we know that blood clots come from can come from, one of the ways that they can happen is from wounds, from open wounds, or a wound that's not healing properly. And if there's wound secretion, that means that there's an infection. And again, if there's an infection and the person's demonstrating indicators or evidence of sepsis, then there's a very good chance there's sepsis. And the first thing they normally do, like I said, is they should put you on antibiotics. Now, if they administer the wrong antibiotics or incorrect antibiotics, that could also be a claim, and that could also be evidence of medical malpractice. So some of the medications that they would normally give, the antibiotics they would normally give, are cafepime, ceftriaxone, penicillin G or beta-lactam for pneumococcal sepsis. They know what they should be giving you, but sometimes when you're in a hospital, it's a very chaotic atmosphere, very chaotic situation, and a lot of times the right medication doesn't get to the right patient. Another indication that there's medical malpractice, if you have evidence that there was a failure to clean the IV lines properly. So we talked about earlier, we talked about how the bacteria can get into these lines, these PICC lines, catheters, because they're not cleaned properly, or they're cleaned by someone who has bacteria on their hands, or they haven't washed their hands. They should be wearing gloves. But again, in the great United States, all over, there's not one uniform, there should be a uniform standard of care as far as how to stay sanitary and make sure that your patients don't get, aren't affected negatively by sanitary problem. But there's the protocol, but it's just not always followed. There also is a failure, another evidence that there's medical malpractice, which leads to sepsis, is the failure, or septic shock, and that's the failure to administer the right amount of fluids. So one of the ways to also deal with sepsis is to give a bolus of fluids. and that's not always done. And again, we talked about improperly sterilized equipment. If you have a bed sore and if you have a bed sore and you're in the hospital, there's usually a good indication that you have not been turned or kept up or brought up on your feet sufficiently. Now, of course, some people can't get up on their feet. They can't walk around. But bed sores happen. One of the main reasons that bed sores happen is because a person stays in a sedentary spot for a long period of time. And we talked on our other episodes, Russ, about how people get blood clots from not being moved around, because a blood clot can grow if somebody stays sedentary. But if you're in the hospital and you're not being moved and turned properly, then a bed sore can happen. Now, bed sores also happen from poor nutrition and diabetes. But if somebody has a bed sore in the hospital, and that in and of itself is actionable, or at least we would investigate to see if there was negligence on the part of the staff, or in a nursing home, or at a assisted living facility, or any area, children's hospital, where someone is not properly turned or monitored for bed sores. But bed sores, if you have a bed sore, then there's also a very good likelihood that a bacteria will get into that bed sore and cause sepsis. So that is another example of medical malpractice, which leads to sepsis. All right. Talking about just briefly about hospitals in general. So if you have surgery and proper post-operative care, again, failure to clean the wounds. I mean, that's really important. Sometimes the wounds aren't cleaned, or sometimes they are cleaned, but they're not cleaned by someone who is sanitary, somebody who has got clean hands. We see it a lot, improper hand washing by medical personnel. Again, poor care for wounds or bed sores, failure of medical staff to wear gloves and other PPE, improper insertion of IVs or other medical equipment, failure to properly monitor the patients. If somebody's in septic shock, again, they've got hours to live. The staff, and I'm talking about somebody that's an inpatient, they have to regularly monitor for sepsis and septic shock. And again, errors regarding patient charts and health records. How many times do you hear about that? Somebody had a horrific thing happen to them in a hospital setting because the doctor or the nurse looked at the wrong chart or couldn't read the writing of the chart, or didn't look at the health records. So those are examples. Any questions on any of those examples, Russ?
No questions, but I did find, while you're talking about this, I was looking on the CDC website, and I found a really good infographic here that is explaining, how to get ahead of sepsis. And obviously, in the hospitals, you were talking about preventing the infections and the good hygiene. So I would have to imagine, you mentioned the statistics in the United States, but I would have to imagine in a lot of the third world countries, because of the factor of hygiene, that sepsis is much more prevalent there.
Yeah. There's no question about it. It's it's a big problem here. You said worldwide, right? Are you?
Yeah, I was, because here in the United States, in the Western world, we have very good hygiene when compared to a lot of the third world countries. So that's where I would think sepsis is it's bad.
Yeah, no, absolutely. And I actually have a relationship with a double amputee. And she actually became a double amputee from sepsis. She actually got food poisoning, it was an infection, and her body just could not fight that infection. She had some other issues. She had cancer previously, and she went into the hospital in septic shock, and they had to, at that point, for her to survive, they had to take off both her legs. It's horrible. And I don't know if there was any medical malpractice. I just recently met her, and I just said, look, I mean, it's the most horrific thing that can happen. I only wish that I had known you back then, because I could have given a pretty thorough look at the medical records and the circumstances to see whether or not there was any medical malpractice. But from what she told me, it didn't seem like it.
With that said, is there a statute of limitations on that?
Well, that's a really good question. So the statute of limitations varies in every state. All right. So in Maryland, which is where I'm talking to you from, we have a 3-year statute of limitations on medical malpractice. Now, that's 3 years from the date you knew or should have known that there was medical negligence. Now, if you didn't find out until year 4, so 4 years later, you found out, you had no reason to believe or should have believed that there was medical malpractice. If in year 4 you discover it, you're lucky, because in Maryland, it's 3 years from the date you knew or should have known, and it's 5 years from the date you actually discover it. So if you don't discover it to one day before the 5-year statute of limitations, you still have 1 day to do it. But we tell everybody it's 3 years. In other states, I can tell you that in Maryland is one of the few states that has a 3-year statute of limitations. Florida just went from 4 years for medical malpractice to 2 years. And California, believe it or not, as progressive of a state as California is 1 year. And I have Californians regularly contacting me about medical malpractice. And I tell them, look, I'd love to help you, but I don't have a lot of time left to do a thorough and a competent evaluation or analysis of your case. You got to get medical records, which take time. We have to give it to an expert, and the expert has to review it. So we can't get all that done. Now, in California, if you give the notice to sue to the potential defendants within 90 days of the statute limit of that 1 year, then it can get extended.
Now,
the problem is that
1 year seems to be really short in period of time.
It's punitive. I mean, it is. I mean, it's ridiculous.
And you're saying in Florida that it went down.
It was 4 years.
And it went down to 2.
For medical malpractice. It went down to 2.
And what would prompt that?
Correct.
I guess
Ron
politics.
DeSantis. Yeah. And Ron DeSantis and the Florida legislature. So, that's what happened. All right. So we're kind of coming to the end. I did want to read to you one case study. I had another one that I wanted to go over, but that actually wasn't medical malpractice. That was a Legionnaires disease case where my client was in her mid-60s, and she unfortunately got Legionnaires disease at a hotel, and didn't really discover that she was feeling sick, but she thought it was the flu. When she came back to Maryland from the vacation, she was already in septic shock. When she got to the hospital, she was immediately ventilated. So she was put on a ventilator because she was in respiratory distress from the septic shock. They ended up having to take out part of her colon because her colon became gangrene, and eventually then they had to put her on dialysis because her kidneys failed. So she ended up, and then she ended up passing away. Unfortunately, it's a horrifying story.
It's ironic that you mentioned Legionnaires disease, and you're saying that led to septic shock.
Well, because Legionnaire's disease is double pneumonia.
Okay.
So Legionnaire's disease is a bacteria that you can get from inhaling aerosolized water that is
So that's the interesting
polluted
part,
with Legionella bacteria.
because it used to be when I would travel and shut down the house, I would turn off the hot water heater, and I was told that when
Bad
you do
idea.
that, it builds up, it grows that bacteria that could lead to Legionnaire's disease.
Well,
So
that's
I
because
left the hot water heater on.
I just settled a Legionnaire's disease case for a senior who died from contracting Legionnaire's disease, who he also went into septic shock. He got it from the hot water heater. The hot water heater has to be kept at 140 degrees. When you turn it off and for a prolonged period of time, then the water is still there and the water is sitting stagnant, and it's the sweet spot for Legionella bacteria to grow.
It's like a breeding ground.
It's a breeding ground. So it's between like 70 degrees and 120, 125 degrees. You can't keep it at 120 degrees. That's just not hot enough. Legionella bacteria, cannot grow in a very, very hot climate.
Good to know. Good to know.
If it's at 140, then it's not going to grow. So anyway, so let me just read you about this situation. So a 36-year-old woman who worked as a CPA at a public university had been a longtime patient of a large multi-specialty medical practice. She went to the primary care division and was seen by the physician who had not treated her before. The physician was a specialist in internal medicine with a subspecialty in infectious disease. The patient's blood pressure was 60/40 sitting and 78/40 laying down. When's the last time you took your blood pressure, Russ?
It's been a little while. I'm due for a physical, but
was it 60/40?
No.
No, not even close.
No.
All right. Normal is 120 over 80, maybe 110 over 70. Most people are above that.
Yeah.
60/40 is very, very dangerous. So she had a temperature of 96.3, a pulse rate of 116. Anything over 100 is something you need to take a close look at. That's, you want to kind of keep it around 90, 80 to 90. And she was described as a very ill-appearing, pale white female. Despite the fact that low blood pressure, elevated heart rate, and low body temperature are suggestive of a life-threatening condition known as sepsis, the physician diagnosed dehydration and administered fluid. Well, that's okay. So he administered fluid. Her blood pressure increased to 100 over 50, and she was sent home with instructions to call if she did not improve. Well, she did call the next morning at 9:25. She told the nurse she spoke with that. She had a chronic cough that was productive in yellow, chest pain from coughing, no relief from cough medicine, and an ongoing headache. The doctor who had previously seen her was told of the patient's call and symptoms, but rather than asking to see the patient, she called a prescription cough medicine. When you've got sputum, yellow cough with sputum and all the stuff from the day before,
sounds like an infection to me.
Sounds like pneumonia.
Yeah.
Right? She's got a chronic cough. Nope. Says cough medicine. Patient. Well, she probably couldn't be bothered. The patient called again at 3:00 and reported that she had trouble breathing. Now she can't breathe. You know what that means? She's probably in respiratory distress. She spoke with the same nurse. The physician claims she was never made aware of that second call. The nurse did not instruct our client to come into the office or go to the emergency room, but rather scheduled an appointment for the next day. The next day, the client's husband took her to the emergency room. She was extremely short of breath and disoriented and was found to have bilateral pneumonia, secondary to bacterium Streptococcus pneumonia. She died the early morning hours the following day. Okay, so I think there was a $1.76 million settlement in this case, which I think is kind of low for something like that. But again, I don't know enough about why it only settled at 1.76. So again, emergency rooms, hospital settings, nursing homes, they are very chaotic environments. And I would just tell you that if you exhibit any of the signs of sepsis, to get to, and it could be your parent, it could be a relative or someone that is a loved one or a dear friend, you want to get them into the hospital. Of course, once you get there, we just went over all the potential landmines that you could step on. So if you think that you have a medical malpractice case as a result of sepsis or septic shock that you think was caused by negligence of a medical professional, call an attorney. You can always call me, Steve Heisler. You can call me at 410-625-4878, or you can email me at any time at shiesler@injurylawyermd.com. That's S. Heisler, Heisler, at injurylawyermd.com. You can go into the show notes and then I'll have my email address. Thanks for watching or listening. I so much appreciate you. I'm really glad that we had this time together. I hope I provided some value and gave you some information which will be useful. God forbid if something like this happens in the future. We'll have a new episode for you very soon. Have a great day. I look forward to hearing from you soon. Look forward to meeting you again very, very soon. Take care now. Have a great day.
Thanks for listening to the Injury Lawyer Podcast. Connect with us at theinjurylawyerpodcast.com and sign up for our newsletter. If you enjoyed today's episode, we would love for you to follow, rate, and review us on Apple Podcasts. To find out more or get help anytime, visit theinjurylawyermd.com or call 855-396-2637. That's 855-396-2637.